Hello, everybody. Welcome to this episode of our podcast. Today, I have my special guest, Dr. Tao Lei. Our topic today is a very common topic, something that every dentist on the planet knows about: toothaches. And while we could go on and on about toothaches, we're going to try to keep things somewhat introductory for people watching this. A little bit of background on you, Dr. Lei. You have a pretty extensive dental education, so you're an ultra geek for sure. You start off in dental school, then you went and I think did a year or two of a general residency with a lot of surgery out in California. And then you got into your specialty training at Harvard for root canals called an endodontist, which clearly endodontists all deal with toothaches. And then you're such a geek, that wasn't enough. 3 years of Harvard. Then you spent 2 more years doing an implant fellowship for 2 more years at Harvard. So, boy, I'm really glad you're here, and clearly you have dealt with every aspect of a toothache. And so I'm really excited to hear what you have to say, because there's a lot of people out there watching this, hopefully watching this, that have had toothaches, know somebody has a toothache, has a sensitive tooth. So let's get right into it and kind of give us a little bit of a brief, because toothaches kind of range. They have, everything from sensitivity to the all-night aching, excruciating pain, get me out of my misery toothache. Tell people watching this a little bit of a brief as to kind of the spectrum of toothaches.
Yeah, majority of patients who come to our office are obviously coming sometimes with emergency dental pain. Usually come in with severe pain that they've experienced the last couple of days, or even last night, for instance, and they can't sleep. They have throbbing pain. And then there's another spectrum of patients who come in with a sudden kind of slight sensitivity to either hot, cold, and also patients who had recent fillings or crowns that were done, that they come in with discomfort, that minor discomfort, and they generally want to either kind of see what's going on. And our job as endodontists is actually just to try to diagnose the problem and determine whether or not they need root canal therapy, or is this something that we have to monitor, or there's other treatments before we recommend root canal therapy. For instance, some patients may develop a cracked tooth syndrome, where, for instance, they may bite in a particular aspect when they're chewing and it hurts. And that usually is, for instance, a very low-grade pain and doesn't necessarily require root canal therapy. And as I mentioned before, patients who recently had fillings, deep scale root planing, for instance, come back with sensitivity, hot, cold.
Is that like deep cleanings, when people have deep cleanings?
Yeah, when people have deep cleanings, generally they come back with, I just had a cleaning, my tooth really hurts. And we kind of do our diagnostic protocols and try and determine what the source of discomfort is. And that's kind of the majority of discomforts that we kind of deal with. And, once in a while we would have a patient who comes in with severe swelling, and we have to handle those emergencies and address it from there. So kind of get a range of patients coming in with numerous number of discomforts.
Sure. So what are the ones that, what are the ones that are more typically you watch them? Sort of what are the highlight ones as far as when patients shouldn't wait? Clearly there are some things that can be monitored, and obviously this is, with the lack of you being able to diagnose and actually see a patient. Clearly, I just want kind of general guidelines for somebody watching this. Okay, when should somebody start to worry? When should somebody maybe think, okay, I'm going to leave this for maybe a few more days to let it see if it settles down? And then when is it that you need to get somewhere quick kind of pain?
If the patient recently just had, for instance, some dental work done, say they just came in for a filling, or they had a crown, a tooth prep for a crown, you generally will have some sort of sensitivity on the tooth. If you think about it, it's kind of like trauma to the tooth. It's like getting a bruise on your hand if you hit something. Usually it lasts for at least a couple of weeks for it to subside. But if the pain gets progressively worse, let's say on a scale of 1 to 10, and the patient rates it as 8, 9, 10, or if the pain is a throbbing pain, a pain that is spontaneous and in the middle of the night to keep them awake, generally those are some of the signs and symptoms that we look for, where we kind of diagnose in terms of how severe the nerve of the tooth, which is called a pulp, how inflamed it is. And usually the two different signs and symptoms that we look for depends on the type of nerve endings actually are activated inside that pulp. Just kind of a general overview, there's basically two main type of nerve endings that are within the pulp. one what we call our C fibers, and the other ones are what we call as A delta fibers. Um, the, to distinguish between the two, the majority of discomfort that you have, say, slight sensitivity to cold, is used by A delta fiber, usually a quick burst of pain. If you have recession, for instance, you drink cold, those are the pains that are activated from those A delta fibers.
So that's like if you bite down on an ice cream cone and you get that little zing, and you put your tongue on there and it goes away. That's the A delta. Those are temporary. They come pretty quickly.
Yeah, generally they're always activating very healthy pulp, as I per se. But when the nerve becomes extremely inflamed, the other fibers called the C fibers get very sensitive, such as, say, in a scenario as a sunburn. Usually you touch your skin, it doesn't hurt. But when these C fibers are activated, that's when you start having these kind of dragged out, long, throbbing pain that lingers as well. And usually it's a dull, aching pain as contrast to what the A delta fiber, which is a quick zing and it goes away.
Okay.
So those are the general symptoms that we look for in terms of diagnosing a tooth that is severely inflamed, and sometimes a tooth that is completely necrotic, meaning that the tooth has no symptoms. Sometimes patients may have just a biting pain, and we have to obviously test the tooth to see if the pulp is still alive. Patients who have had trauma, for instance, on their front teeth could go on for years without developing any symptoms, and suddenly they have some minor discomfort on that particular tooth. And we have our tests that we could run through to determine whether or not that nerve is dead or alive.
You said something about the immediate pain that wakes you up at night, because I have had patients tell me that. What is that characteristic of, the C or the A delta?
In the middle of the night, if it's a spontaneous pain, that would be kind of activating the C fibers.
Okay. So the dull pain, in the middle of the night pain, those are the C fibers. That's the deeper trauma or problematic. Those are more serious on a generalized perspective. Can those ever get better sometimes, or often that's something that says that the nerve may need a root canal, or the tooth may need to come out, or something more advanced than, for example, sensitivity toothpaste?
I mean, generally, once you have those, what we call those throbbing pains and lingering pain that doesn't go away, those are kind of the key indicators that that tooth generally needs a root canal therapy. If you have a minor hot sensitivity or cold sensitivity, for instance, especially after fillings, that can go away. You have to kind of watch it for quite some time. That's why on a scale of 1 to 10, we ask our patients, how would you rate it? If they say, it's in a 4 or 5, generally it's something that we would kind of monitor over time.
Okay.
If we go on to the higher end of the spectrum, those are the indicators that tooth needs some sort of treatment.
More or less, how long after a filling, if it's going to go away, is there a sort of a range of time?
I generally like to wait anywhere from 4 to 6 weeks or so.
Okay, so it can be a little while.
It can be a little while. It can persist for quite some time. And if it's just a cold sensitivity, especially after a deep cleaning, for instance, patients, I generally recommend trying to use Sensodyne, and that kind of helps with the sensitivity they may experience afterwards.
Okay, as long as it stays in that A delta, cold, quick, none of this throbbing, dull pain. So that's kind of the sort of the minor toothaches that can go away. Give it 4 to 6 weeks. It should start to get better with sensitivity toothpaste. Of course, I realize, toothaches have such a spectrum from wisdom teeth to cracked teeth and stuff like that. But these are some of the major highlights I wanted to get into. I did have one last question for you. I heard something about in the north, when the cold comes, that you get more toothaches. Is there any truth to that, or is that just a wives' tale that when the cold and the winter comes, all these toothaches start coming? And you trained in Boston, so you would probably know the answer to that.
Yeah, well, that's actually a very good question because patients who develop a cold, for instance, may develop sinusitis. And sinusitis is essentially inflammation of your sinuses, and there's essentially empty spaces in here that sit above your roots, especially posterior maxillary teeth on both sides. And generally, patients may come in
above your upper back teeth.
Upper back teeth.
That's where your sinuses are.
That's where your sinuses
are.
Yeah.
Okay.
And generally, patients may come in with pain, kind of in the whole region, and they may present with the cold at the same time. And for instance, we tap on the teeth on the whole backside, and all their teeth would hurt. Positional changes actually is one of the indicators that it may be a sinusitis problem. And so that's why I think people are saying that, they may have more tooth pain when it comes to a colder weather. It's mainly due to sinusitis and not particularly, per se, due to the tooth itself. Because the nerve endings are so close to each other with the sinuses and the tooth, it gets referred to the tooth, and that's why you may experience what we call a tooth.
So does that mean in Ecuador there are no toothaches then? Because it never gets cold. I wonder if that's the case. But anyway, okay, listen, Dr. Lay, I really appreciate it. I hope anybody here watching this enjoyed this video. Hope you learned something from the video. I hope to have you back for more and more episodes because there's such a scope when it comes to root canals and so many things that I think you can teach the people watching this. So this is kind of an intro teaser. Anybody out there watching this, I hope you enjoyed it. Hope you learned something. You can contact either one of us with the information on the screen. We're also always happy to try to write and respond back to comments. Dr. Lay, I really appreciate your time.
No, thanks for having me.
Thanks.